Last point, but a big point. This is a pivotal moment in this country. You look at what's going on across the nation, and people should be concerned. You're seeing the virus go up across this country. Concerns me that you see other states going up. Concerns me as an American. Also concerns me on a parochial level, because those people in those states may get on a plane, may land at JFK, and this could start all over again. That's how we got here the first time. How did the number of cases get so bad so quickly? People came from Europe to JFK, and nobody told us that the virus was in Europe. That's the fact for the history books. Everybody said the virus was in China. Look at China, look at China, look at China. Yeah, baloney. It wasn't in China. It left China, went to Europe, it came here from Europe, and 3 million Europeans landed at JFK January, February, March. March, the nation did the European travel ban. By then, 3 million Europeans had come. And that's how the virus came. We now have the virus under control. Yeah, but Florida doesn't, and Texas doesn't, these other states don't. And what happens if they get on a plane and they come to JFK? So we get the infection rate down, and then because other states are high, we could have a problem. This country has to wake up and smell the coffee, right? And let's realize the facts that are going on as we sit here this morning. Because my father's great speech, Tale of Two Cities, you now have a tale of two countries going on. You have two very different situations happening in states across this country. Some states, the numbers are going down. Some states, the numbers are going up. Why? Same country, same virus. Why? The federal government's attitude is an undeniable mistake when it has come to dealing with COVID. Their guidance, their doctrine is an undeniable mistake. It is a political theory, a public relations theory, versus a science-based, fact-based theory. The White House, from the day one, has been operating on a pure political ideology. We should reopen, get the economy going, government shouldn't be slowing down the economy. It was all political. It was all public relations. Based on what fact? Based on what science? None. It was all political ideology. We said here in New York, this is not about politics. Virus never said to me it's a Democrat. Virus never said it's a Republican. No test ever said that. Dealing with a virus is a matter of science. It's a matter of fact. That's how you deal with a disease. You don't deal with it politically. And you now see states that have dealt with it politically versus states that have dealt with it on a science, fact basis. And you see the virus spreading in states that have an unmanaged reopening. Well, because they always have an excuse, it's not really increasing. The number of tests are increasing. I don't even know what that means. More testing does not mean the viral spread is increasing. You know how you know that they're being disingenuous? The number of people in those states who are getting sick is increasing. Forget the numbers. More people are walking into hospitals. They're not walking into hospitals because they're feeling well. You walk into a hospital when you're sick. And the number of people who are getting infected and getting sick and walking into a hospital is going up in these states. Undeniably. And you can go state by state. It's Arizona, it's Texas, It's Florida, it's North Carolina, it's South Carolina, it's Utah, it's Montana, it's Alaska. It's 20 states are on the increase. And then compare that to New York, where we are on the decrease, day after day after day. We've been on the decrease for the past 60 days. 2 months of decline, they're going up now. How do you explain that? What happened with this virus? What happened with this pandemic? From the get-go, was always going to be dependent on what we did.